Well, not everything warrants a trip to the ER, but you can't always plan for illness and injuries either.
The best choice might be QuickSick. It's a form of urgent care from OneWorld Community Health Centers.
Physician Assistant Vicki Bangert is here to give us an idea of who can be seen and for what. Good to see you, Vicki.
Nice to have you
for
here.
Stopping by. Yeah. So, what's the difference between QuickSick and just going to the ER?
An ER is more for life-threatening, potentially life-threatening emergencies. They're going to deal more with the severe things like chest pain, difficulty breathing, stroke symptoms. A QuickSick or an urgent care is often a better choice for people with minor routine illnesses. We're not set up to handle major trauma or anything like that, but just for the everyday run-of-the-mill illness.
Give us a few examples of the things you see most at QuickSick.
Yeah, sore throats, urinary tract infections, fevers, rashes, anything that is acute but not severe.
Right. I think you made a good point there, because I've been to the ER before, and the ER is there to save your life.
Right.
And you don't always have these life-saving events that you need to go into the ER. So I think it's a great idea. But so who can be seen? Who are we talking about here?
Well, we can see anybody. The only exclusions that we have at our particular QuickSick is we don't see newborns under 2 months, and we don't see pregnant patients, and there's different reasons for that. But other than that, we can see anybody regardless if you have insurance or not.
Open to the public.
Open to the public,
Anybody can
yes.
come in.
You mentioned insurance briefly there, so let's talk about the cost of a visit, because that's something else. People are saying, I don't want to go to the ER because it's, I mean, a lot of that stuff, even if you didn't need it, the cost would deter you. So what's the story with QuickSick?
Right. In the QuickSick, we take all types of insurance. So if you have any insurance or Medicaid, it would just be your copay for your regular insurance visit. But if you don't have insurance, we can put you on a sliding scale fee. We do recommend that you bring your income statement, proof of income, so that we can put you on that sliding scale fee. But if you don't bring it, we can charge you just a flat $85 fee, and then you have 10 days to bring your income statements back, and you could be reimbursed for a lower price if you qualify.
A lot of the times when patients come into QuickSick, you know, it's maybe for an injury or an illness that suddenly came on. So there's not much time to plan ahead for these events.
Right.
Do you need to call ahead before you come in, or just show up?
No, you can just show up. We're on a walk-in only basis, and so we don't triage. Since we see less emergent illnesses, it's first come, first serve. So while if there's a lot of people, you may wait a little bit. Our goal is to try to reduce the wait time.
Flu season's coming.
That's true.
Don't we
yes,
know that's
it
true?
is.
Yes.
It's
So
coming.
we'll start talking about protecting ourselves,
Yeah.
getting everybody healthy. The flu shot, is that something you do at QuickSick?
We don't typically give the flu shot out, but we do recommend everybody that can get the flu shot to get that. And, you know, just basic things like washing your hands and kind of isolating yourself if you do feel like you have flu symptoms coming on, not going to work or school.
You're a physician assistant.
That's
My
correct.
husband is not. He doesn't work in your industry. He really doesn't know up from down, but he suggests that the flu shot will give him the flu. Would you, for him and everyone else, clear that up?
Sure. The flu shot, in fact, does not give you the flu. It's a dead virus, so you're not going to get sick from it. A lot of people may get a cold or something, and it's not actually the flu, but they're not related.
Yeah.
In no way the flu shot gives you the flu.
I've tried to tell him.
Well, is he watching, or do we need
I
to
hope
call
so.
him and get him on the
I
phone
will
with Vicki
play
here?
this clip back for him later if he's not watching live.
Again, it does not give you the flu.
Yeah. Can we pick your brain about antibiotics for a little bit?
Sure.
Antibiotics, they treat a whole host of symptoms and issues. What do you think? Some people think that antibiotics should be used all the time and they clear everything right up. But what are your thoughts on that?
Well, it's our job when a patient comes into the clinic to decide if antibiotics are needed. So you have a virus or a bacteria. Antibiotics work great against bacteria, but not against viruses. So we do a lot of education with our patients when we don't feel like an antibiotic is needed, because they do. A lot of people come in with that theory that they're sick, they need to get better now, and the only way to do that is with an antibiotic, which is not true. Viruses will run their course, and actually you can have harmful effects from giving antibiotics when they're not needed.
Well, you build an immunity to antibiotics, don't you?
You can get resistance, and so that's part of our job as well. There's growing antibiotic resistance. There's not a lot of new antibiotics coming out on the market. So in order to prevent that resistance, you don't want to give patients antibiotics when they don't need them for a virus. So, you know, we can do as much as reassure you. We can tell you more than likely if it's a virus or a bacteria, and so we can reassure you if you don't need antibiotics, and that's a good thing, because viruses will run their course.
I get a sense you enjoy your job.
I do.
What do you like most about it?
I like our diversity of our patient population. We see people from everywhere, and sometimes to hear their stories is amazing, but also just to get people back on track. Most people come in, they want to get better, to go back to work or to send their kids back to school. So just getting them back to their normal daily activities is amazing.
Wellness is a beautiful thing.
Yes.
Isn't it? So let's show you the hours for Quick Sick. Again, walk-in only, and they'll take the insurance in. If you don't have you know, the sliding scale, there's information about that online as well. But the hours we want to emphasize, because this is a point of convenience. The location is also going to be important information for you to have as you're thinking about it. Maybe plug some information into your phone so you have the address, you know where you're going if you'd like to visit. The number that's on the screen there as well. But again, no appointments are necessary. And this whole OneWorld story, as we've visited with other professionals, it's about access.
Right, right. Our goal is to just treat anybody that we can.
Yeah, well, Vicki, it's a good time to be talking to you because we're heading into that flu season.
That's right.
So thanks for all the reminders.
Back to school, the germs are everywhere.
Yeah.
Bring it
Thanks,
on. Thank you.
Nebraska